our bottom line is to provide comfort and symptom management, and the Macy has been a very valuable tool for us. All of the patients that I've used it with, I've found it to be extremely effective. It controls pain. It's an excellent symptom management tool. It is our preferred method. With our experience growing, we've been able to promote it and its efficacy to our patients, and they are very receptive.
I had a gentleman that wanted to be removed from his ventilator, and he wanted to do that at home, and he wanted to do it with his family present. It was really important to him, so we did get approval to use the catheter for morphine administration, and then we were using a CAD pump for versed administration. We had been there probably 4 hours. It's 2 nurses titrating this CAD pump up, and up, and not achieving the symptom management that we wanted. So we had gotten to the point that we had maxed out our medication doses and couldn't use the sub-Q site any longer. So decided we were gonna use the Macy catheter. And within 15 minutes, we had achieved symptom management for this gentleman. We ended up removing the ventilator about 5 minutes later, and he passed within 20 minutes of us switching from that CAD pump to the catheter. In hindsight, had we started right away with the Macy catheter, it would have been a much quicker visit, much more peaceful and comfortable for the patient. It achieved what we wanted much quicker.
The ability and the willingness to not make somebody earn their symptom relief meds has been improved by the Macy. I really trust in a way I never did before that the absorption of it rectally is much more effective than sublingual.